people who are mentally unwell, sometimes they behave in ways which aren't acceptable within the society that people live in. And sometimes that behaviour can be unusual, difficult to understand. And people, consequently, if they see things that they don't understand, they don't want to think about it or engage with it. And if, going back 100 years ago, we would build the asylums and put people who were mentally ill, put them in the asylums and forget about them. And I think that's probably something that, in a sense, we still do today. We don't want to think about people who might be different to us.
I'm often left thinking, what more could I have done? So it's challenging to kind of be clear about what your aims are with the person and stick to that. And also you're working with people who are distressed or anxious or experiencing a really difficult time, and that sometimes can be directed at you. So you might have times where you might experience some hostility from somebody, or they might be directly challenging to you in terms of their behaviour, and that's hard sometimes to understand that that's not necessarily about you, that it's about the experiences that the person's having, and distance yourself from that and cope with it as a person.
I think there's quite a few challenges. I think one of the biggest challenges as mental health nurses, on behalf of the people that we work with, is trying to deal with the issues of stigma and discrimination. I think mental health patients still experience in the workplace and the communities that they live, people who don't understand what they're going through. And I think because it's a hidden illness often, as mental health nurses, we're there to try and explain to people what they're going through and advocate on people's behalf.
In my view, the fact that mental health condition cannot be pinned down to a particular known cause is the biggest challenge of it. If somebody has diabetes, we know what causes diabetes. That makes the treatment and management of diabetes much more easy. But in terms of mental health, what will precipitate mental health in one person could be absolutely different from the next person. And that is where the challenge really, really lies.
It's really hard not to be emotionally involved and not to, you're going to experience an emotion. I still do. Most days there'll be something that happens where I will experience an emotion, whatever it is. I might feel sad, or I might feel angry or frustrated, and that's completely normal, and we're human beings. And the important thing for a mental health nurse is to notice that that's happening and then not respond according to that emotion.
I think my coping mechanisms are really, first and foremost, trying to involve the whole team, so that the whole team, we're all behind each other. Even if a situation happens that's very negative, we all rally together, and I can get support from everyone in this team. And then I've also used supervisors, because at times the situation has happened and I just want somebody to hear my story. And so I got somebody to go to and say, this is what happened. At times they don't even have an answer, or they're just sitting there but listening, and that's really important to have somebody who listens. And to be able to say thank you to everybody on each shift when it ends. Thank you, and when we leave the workplace, then we leave everything here and come back to it tomorrow.
Excellent. So there's a lot of camaraderie within the team.
And that's needed. That's really needed in mental health.